capita. And that is a very good deal for averting tens of millions, hundreds of millions of deaths, because we already know that that's possible. The Lancet in 2007 had taken 23 low and middle income countries and estimated that 5.5 million deaths could be averted over 10 years if these Best Buys were scaled at a cost of less than 40 cents per person. Here's the costing tool that we went through for low and middle income countries. As you see, the grand total for scaling between 2010 and 2025 would be $620 million total. So we have a long ways to go. We have to do this because the WHO Global Report on the Tobacco Epidemic, the last one we released with 2010 data, shows here the power package. The blue lines here show that apart from mass media, less than 20% of the world's population are covered by any one of these demand reduction measures at the highest level of attainment. And for us really to make a dent, for us to make an impact on tobacco prevalence, you've got to implement these measures at the highest levels of achievement. We did show progress. We showed that 1.1 billion people were covered by a new policy over 2 years between 2008 at the highest level of attainment. We also, this slide I made just for this meeting. We've never put this together before, but this shows why we have to implement. We have to have the political will to ratchet up and the implementation of these measures at the highest levels of attainment. Uruguay, they have 4 Empower measures at the highest level of achievement. Look at Uruguay. Since the last 5 years, they've reduced their tobacco consumption, tobacco prevalence rate precipitously. In fact, Uruguay achieved a 25% reduction in tobacco prevalence over 4 years. Turkey, 14 years ago, had no tobacco control legislation. In the last 5 years, it has become one of the front runners in the world. Look on the right-hand side. Precipitous reduction in tobacco prevalence. It requires political will. We have the tools. We have the convention. We can do it. Australia, one of the lowest tobacco prevalence rates in the world, 16% now. You've seen a gradual reduction as Australia has continued to strengthen their tobacco control measures. Australia is now moving with a target for 2018 to less than 10%. Will be one of the front leaders in the world as it already is in the world. And again, culturally, socially appropriate, yes, in this region, across the spectrum. These are countries that, in our last report, had the highest level of attainment for any one of the power interventions. It's good, but it's not enough. As you see, there's only 2 or 3 countries in each sector. We have best practices, such as Iran was the first country in this region to adopt a comprehensive tobacco control law and specifically require big graphic pictorial warnings over 50% in line with the Article 11 guidelines of the Framework Convention, and that's continued to scale. Jordan was a country that had tobacco advertising and marketing in theory banned since 1977, but they weren't doing a good job of actually implementing or enforcing it, and they were still allowing point of sale. So they banned point of sale in 2008, and they've really taken enforcement very seriously. They've trained 35 health promotion coordinators. They have a enforcement squad, so to speak, now to make sure that this law is being implemented. Our next global report on the tobacco epidemic will focus on this area, and this is a very good model for this region and the rest of the world. Egypt, restructuring their taxes in year 2010 to flatten out their tax system so that there were different types of taxes for different types of tobacco products. They did this very successfully with the dual goals of reducing tobacco consumption and also mobilizing some of those funds to support universal health care in the country. This is the leading edge of where tobacco control is going in the world. Australia, there's literally a war between public health and the tobacco industry right now over plain packaging. What is a plain pack? Look at this. This is what a plain pack is. No more camels, no more cowboys on the package. Australia did a very good study showing that the most repulsive color for a smoker, for a tobacco user, is kind of a drab brown olive green color pack. So that's the pack color. It's going to be drab brown olive green color. There will be brands allowed, but it will be a standard black font. All companies will have to put their name, Marlboro or whatever, with the standard font. Big picture, graphic pictorial warnings for public health, and on the side also of the pack will be a mark and a message for people needing help. This is the perfect, I would say, the epitome of a whole of government approach, because to get here, Australia's had to have every ministry on board. The Minister of Trade, for example, described this law as anti-cancer, not anti-trade. So just going on to the high-level summit and what it meant for tobacco control. The Declaration on NCDs recognized the fundamental conflict of interest between the tobacco industry and public health. That is a must for any country that's going to make a headway in tobacco control. No shape or form should the tobacco companies be involved. And also the Declaration commits the member states to accelerate implementation of the Framework Convention on Tobacco Control, and also the best buys, recognizing the importance of implementing population or individual-based, cost-effective, feasible, affordable, low-cost measures. And again, very important in the context that the World Health Assembly, at the top bar here, the World Health Assembly, all member states have already adopted a premature mortality reduction target of 25% from 2010 to 25. Tobacco smoking, a reduction of tobacco smoking, will be a key contributor to this premature mortality reduction target. There's already on the books, and we hope will be completed. There's been a lot of buy-in for a tobacco smoking reduction target of 30% by 2025. But to do this, we have to remember all the time that the tobacco industry, like the Anopheles mosquito for malaria, is the vector of this epidemic. And under 5.3 of the Framework Convention, the tobacco industry is the first treaty in UN history that includes a specific obligation for parties to protect these policies from the commercial and other vested interests of the tobacco industry, not believing the tobacco industry's exaggerated economic propaganda, not believing front groups which inevitably will lobby governments, hospitality sector or whatever to dilute bans on smoking in public, and also intimidating governments. In the words of our Director General, Dr. Chan, the Framework Convention is a tool for fighting back. We have the best buys and good buy measures in the Empower package. Full implementation of the WHO FCTC would deliver the single biggest preventive blow to heart disease, cancer, diabetes, and respiratory disease. But we have an enemy, the tobacco industry. It's changed its face, it's become much more aggressive, and she calls and has continued to call on heads of state and government to stand rock hard against the despicable efforts of the tobacco industry to subvert this treaty. So just to close off, a tobacco-free world is attainable. WHO and our partners are here, willing, ready to help to bolster the interventions. We know the interventions. We just need the political will to scale them. Thank you.